Introduction to Hazard Analysis and Critical Control Points, HACCP. HACCP is a food safety management system developed for companies involved in food circulation. The abbreviation title of the system, HACCP, means Hazard Analysis and Critical Control Points. The study material introduces the objective of the system, its tasks, basic principles, and phases of development. The objective of HACCP is to ensure the quality and harmlessness of food. The system is used in all phases of food circulation, from field to table, thus excluding hazards for consumer health and life as much as possible. Food Safety Management System consists of three external elements: prerequisite programs, HACCP principles and procedures, principles established by European Commission regulation, traceability, recall, communication procedures, and two internal elements: self-control system that is based on HACCP principles, prevention and readiness. HACCP could be characterized as a systemic approach for the identification and control of hazards that can make food unsafe. These hazards can be microbiological, chemical, or physical. Why do companies need a HACCP system? Because it enables prompt identification, assessment, and control of potential hazards for food, planning and introduction of control actions, ensuring food quality that complies with the requirements of regulatory enactments and consumer expectations, improving the work efficiency of the company, promotion of product sales on the domestic as well as foreign markets. The presence of HACCP system at the company is essential in the event where product or raw material export to the member states of the European Union occurs or is planned. Already in 2004, a set of regulatory enactments governing hygiene requirements, called Hygiene Package, was adapted in European Union, which is constantly being improved. The current food safety policy is based on a series of principles which can ensure the following: traceability, risk analysis and prevention of hazards, protection of consumer interests, free circulation of harmless and high-quality products in the internal market of the European Union as well as in trade with third countries. HACCP procedures. Regulation number 852/2004 of the European Parliament and of the Council on the Hygiene of Foodstuffs provides that market members involved in food circulation must introduce, implement, and maintain constant procedures that have been developed on the basis of HACCP principles. Procedures or descriptions of practical actions are usually included in the self-control system of the company. The procedures must be documented. It is important to ensure that documents and records are drawn up in the manner that enables the company to confirm that HACCP procedures are introduced at the company and are used in daily operations. Prerequisite programs are preventive measures and conditions that must be met prior to the introduction of HACCP and during the maintenance thereof. The programs include mandatory conditions and measures to be implemented in order to ensure the safety and sustainability of food at all stages of food circulation. Two types of programs exist: prerequisite programs, which include basic conditions for ensuring food hygiene. Most significant hazards are controlled by introducing operational or process prerequisite programs. The programs must be commensurate to the size and type of the company. Responsible persons who monitor the introduction and maintenance of the programs must be appointed for the implementation thereof. Procedures that ensure the traceability and recall of food in the event of non-compliance of various types are considered to be a part of the prerequisite programs. In Codex Alimentarius texts, prerequisite programs are called Codes of Good Practice. Codes of Good Practice can include good agricultural practices, good veterinary practices, good hygienic practices, good manufacturing practices, good distribution practices, good trading practices, and others. Codes of Good Practices are much more detailed than prerequisite programs, since they include good practice recommendations that are traditional and characteristic of certain sectors. The prerequisite programs contain a minimum set of requirements that is provided by the regulatory enactments. In 2002, the European Commission adopted a regulation which provides the general principles and requirements of legislative enactments on food circulation and procedures associated with the food safety. The regulation determines the basic principles in the area of legislation. These principles are as follows: hazard analysis, traceability, precautionary principle, protection of consumer interests, and others. The Regulation 178/2002 defines to food business operators responsibilities and obligations. They have to ensure food safety, responsibility, traceability, transparency, urgent action, prevention, cooperation. In the meaning of a regulation, traceability is the ability to track and find any food, feed, productive animal or substance that must be or could be added to food or feed at all stages of production, processing, and distribution. An efficient traceability system should enable the tracking of products a step forward or backward in the supply chain and to answer the questions of when received, where situated, and where from they have come. This means determining the origin of the products. Self-control system is activity of the company that is based on HACCP principles. It is developed considering the size of the company, manufacturing processes used, and other factors that could affect food safety. Each food company develops their own individual self-control system or procedures, which include descriptions of practical actions and respective instructions. HACCP is developed and maintained observing 7 principles. Conduct hazard analysis. Identify critical control points. Establish critical limits. Establish monitoring. Establish corrective actions. Establish verification. Establish documentation and records. Each principle is reflected at certain stage of HACCP Introduction. Principle 1. Performing the detection of hazards that must be eliminated or reduced to permissible levels or hazard analysis. Principle 2. Determining of critical control points at the stage or stages where control is required, to prevent or eliminate all applicable hazards or to reduce them to minimum permissible levels. Principle 3. Establishment of critical limits at critical control points to separate acceptable results from unacceptable ones in order to prevent, eliminate, or reduce identified hazards. Principle 4. Development and implementation of efficient monitoring procedures at critical control points and the development of the monitoring system. Principle 5. Ensuring the establishment and implementation of corrective actions if it is concluded during monitoring that the critical control point is not monitored or that no required action is taken to eliminate the incompatibility. Principle 6. Development of such regularly implemented procedures that are used to check whether the actions taken within the framework of previous principles are sufficiently effective, respectively, performance of verification or practical inspection of the system and procedures. Principle 7. Development of the product recording procedure that conforms to the type and size of the food company. The documents that are developed and stored prove the actual applications of the actions listed in HACCP. HACCP Implementation Steps. It is recommended to structure the establishment of the HACCP system, which incorporates all production processes and elements, in 12 steps. However, it is not a mandatory requirement. 12 steps of HACCP implementation are as follows. First, establishment of work team. Second, preparation of product descriptions. Third, determining the objectives and types of product use. Fourth, development of flowchart. Fifth, approval of the flowchart at the site of production. 6. Identification and analysis of potential hazards and defining control actions, Principle 1. 7th. Identification of critical control points, Principle 2. 8th. Identification of critical limits for each critical control point, Principle 3. 9th. Development of supervision or monitoring system for each critical control point, Principle 4. 10th. Establishment of corrective actions, Principle 5. 11th. Establishment of verification or inspection procedures, Principle 6. 12th. Establishment of documentation and registration system, Principle 7. Depending on the size of the company, types of manufactured products, production volumes, number of employees, and other factors, various derogations and diversions from HACCP procedures and principles, as well as hygiene requirements, may be applied. However, the management of the company and employees responsible for the HACCP system must assess how these digressions can affect food quality and safety. Activities related to the establishment and maintenance of the HACCP systems in small enterprises include separate HACCP principles, which may be carried out by one person temporarily or regularly assisted by external experts. We don't work for one day. What we create today will be in use for future generations. We have to be aware of how to do it and how to take care of these values responsibly.